Okay, we're recording.
Thanks. We're just going to start out. I'm going to introduce myself, say today's date, and kind of how we're recording this, since it's kind of unique.
Okay,
And then I'll just ask you to introduce yourself and just say a little bit about what you do. Then we'll get into the questions.
sounds good.
All right. Today is October 19th, 2020, and we're recording this oral history via WebEx and at Morehead State. And if you could please introduce yourself.
Sure, thank you. Today's October the 19th. My name is Jay Morgan, president at Morehead State University.
And Dr. Morgan, where are you originally from?
Spent most of my career down in Western Kentucky at Murray State University, and also a little bit in Frankfurt and then here.
And how long have you worked for Morehead State?
This is my third, going on fourth year, I guess, in my fourth year right now.
A good amount of time. And now we'll go ahead and start with some more COVID-oriented questions.
Okay.
When did you first hear about the coronavirus? And when you did, kind of what did you think about it?
The first time I heard about COVID-19 was probably about the first or second week of March of this immediate last spring of 2020. I was in a meeting with a number of other universities, and we were just talking, and one of the individuals at the meeting or on the call for the meeting mentioned that there was a pretty rough virus going around. They didn't know a lot about it, and that started at least my knowledge of it. I think that was about the first or second week of March. And then probably a week later is when all the information started coming out from the public health agencies, a number of hospitals and so forth. So right around mid-March.
And I think that's kind of the census of when most people
Mm-hmm.
started to get on their radar. And so I know there was a lot of rapid information coming out then, and we ended up leaving campus early that semester and finishing online. If you don't mind, could you kind of walk us through how that determination came about?
Sure, I'll be glad to. I mentioned we found out about it, were made aware first or second week of March. We spent probably the next week or so talking to a number of public health agencies who didn't know a lot of information about it. They would have little nuggets and tidbits that they, would provide to us. We talked to a number of physicians trying to get more information, chief medical officers. I spoke with a number of colleagues over at St. Clair Healthcare, which is, as you know, borders our campus, trying to find out a little bit more of the epidemiology behind this virus. Certainly was something that most all of us didn't know much about. After about a week of that, we were starting to get pretty close to spring break week for Morehead State University. And I remember during the first couple of days of spring break, having a lot of very deep discussions here on campus with a number of administrators of what should we do. It was at that point in time that I remember starting to see the first university empty their campus out. And we saw this 2 or 3 times, and it was a little bit shocking to me. I thought that was, a pretty broad and drastic thing to do, to send everybody home. But nevertheless, we didn't know a lot about COVID-19. Over that succeeding 1-2 days of spring break is really when the conversations got really deep with public health departments, number of agencies in Frankfurt, number of chief medical officers. And sometime during that time, we thought, well, maybe we need to give this another week to figure out more. And then it became very readily apparent that the most precautionary thing to do would be to send everybody home after spring break. And that's when we started pulling that information together.
Well, I definitely think, in hindsight, that was probably one of the wisest decisions that could have been made there.
You know,
That would definitely help.
I,
It definitely helped any
nobody,
potential infections stay away.
right? Nobody knew much about COVID-19. It was particularly, we didn't know how it would affect students in the residence hall, students in classrooms. We didn't know if people were just going to be, minorly affected, or if this were an extreme case of something really, really bad. So we erred on the side of caution. We were not the university to call off the rest of the spring semester, nor we weren't the first and we were not the last. So I think we made a pretty good decision, although it was a very, very turbulent time for campus.
Yes, sir. And when we started getting closer to this semester, the students anyway, were made aware the university kind of partnered with St. Clair for health and testing. How did that come about?
Well, one of the things that we had been working on all summer long was how do we safely build capacity to bring students back to campus? If you go back to right around roughly June the 1st, we had a plan. It was very phased. We brought some of our staff back to campus. Many of them had not been to campus from that roughly right after spring break all the way up to June the 1st. I never left campus. I was here 4, if not 5 days a week, week in, week out, since all this started. And so what we did is, leading up to June 1 and starting June 1, we started bringing back a few of our critical staff just to make sure that we could assimilate them back into operations. We brought a little bit more of our staff back in mid-June. We brought some more back in early July. And then starting late July and August, we started bringing students back in shifts. We had some move in early, some move in a little bit later. And as part of that, we wanted to try to encourage, but not mandate, we wanted to try to encourage as much testing for COVID-19 as we could. We recognize, and we actually tried to go out and purchase 10,000 COVID-19 tests to have here on hand. So when every student came back to campus, we'd have one of our nurses or a medical professional provide the student the test. We were told we could not purchase that many tests. So our backup plan, and it actually wound up working pretty good, was really to bifurcate the plan to say, okay, students, when you're coming back, please try to get tested in your home communities, because in actuality, our medical professionals were telling us, do not wait till students get back to campus to test them because they're already back. They need to be tested in their home community. So if you remember a lot of the communications around late July, 1st of August, we encouraged students to get tested in their home communities. We did actually have a number of students call and say, I tested positive. We worked with them to stay at home another couple of weeks till they were better, and then we brought them back. We tested a number of employees, but we also worked with St. Clair Healthcare here that just on the other side of our campus to test a number of students when they got back. We tested a lot of our athletes. We tested a number of our employees. So I feel like our testing protocol was pretty good, and we've tested on campus several times since then. You might have noticed some emails have gone out periodically about testing down in the Laughlin Health Building. I think the most recent one was maybe sometime mid last week or so. So I will share that we've been very fortunate. Our total number of cases here have been very, very, very manageable and small. You can actually look at our website and see they're very consistent too, week over week. 4, 5, 6 students on campus, a couple off campus, sometimes one employee, but most of the time 0 employees. So not only we had a low number of cases, but it's been consistent each week. So we've managed it very, very well.
Yes, sir. And how have we kept cases so low? Because I know some other universities have had to move back to online because they couldn't handle it.
But we believe that it's been a combination of things, and we did not hinge all of our strategy just on testing. We hinged our strategy on a number of things, and what we wanted to do was create as many layers as possible in order to make up a very thick fabric, not just testing alone. So as you know, we encouraged and really required masks in all buildings. I have to say the students have been wonderful. They even wear it out on the sidewalk a lot of times. So students have been very much part of creating a positive culture around precaution. We've done not only just singular testing along the way, but we've tried to test a number of times at different times throughout the semester. We also have what I think is a very good protocol. As soon as we find out an individual may have an issue, whether they're positive or just anticipated, we have a COVID-19 rapid response team that immediately begins working with that student to try to get them, tested over at St. Clair, try to come up with the best case management plan possible. I think that's mitigated a lot of our issues. Also think we moved a lot of our courses to hybrid online, so there's a good mix of course methodology and delivery for this fall semester. As you know, we've got outside tents, picnic tables. We've tried to encourage people to get outside. Just about every event we have is virtual for this whole fall semester. So I think when you start putting all those together, among other things, it's really provided for a nice environment for us. And we're a smaller campus, so we can control it a little bit better.
Yes, sir. And I know a lot of the students are glad we've been able to keep them low so we can still have our in-person classes in person.
Right. And I think the students have done wonderful.
Yes, sir. And how has the pandemic changed how you use technology, sir?
Well, it's obviously exacerbated the way we use technology in some ways. Our campus had a pretty good feel for course delivery and online format even before COVID-19 came into the equation. We generally would deliver about 30% of all of our courses online even before the pandemic. So we were a little bit of an advantage when COVID-19 began to come into the equation in March, because we already had a head start among what other campuses. A number of other campuses had drastically fewer classes online. So one of the things that it's done is over the summer, we provided multiple training venues for our faculty and staff to try to skill them up on some advanced use of technology. We didn't want to be caught again like we did in the fall, last spring, this fall, have some more interruptions and not be able to deliver a quality instructional product to our students. So we had a number of summer trainings. We've also had a number of trainings this fall to try to skill them up even more so. One of the other things that we did was, instead of replacing kind of that normal replacement process of desktop computers like I'm using here for our interview with a camera component, we've made a pretty hard swing to when faculty and staff computers become out of date or old, we're replacing those with laptops, built-in cameras, portability. They can work some here in the office on campus, They can go home and work a little bit, and that portability is really valuable. So we tried to not only skill up the campus for the delivery, but also the hardware that we have. We bought a lot of cameras for campus. We did a number of other things. So I think it's probably been the general direction we've always wanted to go. We just had to push it along very quickly.
And are there any final thoughts you'd like to add, sir?
Well, I continually at all interviews, and this being one of them, I've had interviews with radio stations, TV stations, newspaper reporters, public health officials across the board. The thing that I always try to end with is our campus has, number one, done a phenomenal job. You can look at our case counts, and at least to date, compare that with other universities, and you can see that we've done an excellent job here. And I think that speaks to the teamwork. We knew right offhand that we could not have just our staff on board or faculty on board or students. Everybody had to be on board, everybody, for our campus to do well. And I can't say enough good things about our students for their participation, wearing masks, trying to be careful, hosting events virtually, and our employees have done a phenomenal job. So our people and their proactiveness is what's got us this far and this successful so far. So that's how I'd probably end it, and really thanking our campus for the good job they've done. I think we can turn around and do this again in the spring and do a phenomenal job then as well.
Thank you for this interview, sir, and thank you for your time.
Thank you.